Hi, my name is Bethany Yeiser. I serve as president of the CURESZ Foundation, and today I'm here with Dr. Henry Nasrallah, who is a professor of psychiatry, neurology, and neuroscience at the University of Cincinnati College of Medicine. He is also the co-founder of the CURESZ Foundation and an active board member. And today we wanted to talk a little bit about LAIs, long-acting injectable antipsychotics, which are one of the very best options for patients that we have, but at the same time are very underutilized. So
I completely agree with you, Bethany. They are really one of the most important tools we have in schizophrenia. And just for the viewers who don't know what LAIs are, long-acting injectable antipsychotics are a medication that like 1 or 2 cc's injected into the muscle, and they basically ooze slowly for a whole month and protect the patient as if they're taking pills, but without pills. So it's really an incredibly useful invention because many of our patients with schizophrenia do not take their medication. They stop them and relapse.
the vast majority.
The vast majority do, exactly. And it's really tragic they do that because patients with schizophrenia don't realize it. And even psychiatrists didn't know that until about 20 years ago. We discovered that psychotic episodes are very destructive to the brain. They kill hundreds of millions of brain cells, both gray and white matter. So the long-acting injectables make sure that the medication reaches the brain of the patients without interruption, day in, day out. And these injections are available 1 injection a month, sometimes 1 injection every 2 months, or once every 3 months, or once every 6 months. There are like 5 of them on the market by various companies, all of them approved by the FDA for use in schizophrenia. I personally find them to be the most important approach to managing patients with schizophrenia because there are 6 tragic consequences of psychotic relapses. It's really devastating, and that's why most patients end up being disabled. Number 1, brain tissue loss. Every psychotic episode leads to brain tissue loss. Number 2, treatment resistance. Like what happened with you, Bethany, with every relapse, you stop responding to the same dose that worked before because the brain changes. With the destruction, every episode changes the receptors, changes the connections. It's no longer the same brain. So imagine you keep increasing the dose until finally even the highest dose doesn't work anymore. That's the second serious consequence of psychotic episodes. Number 3 is functional disability. Many of our patients are college kids, freshman, sophomore, when they get their first episode, and we treat them, and they respond very well, and they can go back to college actually.
Until they go off their medication
But then, exactly, once they get off the medication and get a second relapse, it's very hard for them to go back. Their brain becomes unable to learn and focus, and so they drop out of college after the second episode, not after the first, because they respond well in the first. So that's another heartbreaking consequence when you can't work, you can't go to school for the rest of your life. Number 4 is incarceration. And our patients, Bethany, you were arrested.
I was briefly incarcerated
Yeah.
twice. Yeah.
And
Well, very psychotic.
and that's before you came to the hospital. But patients who are treated and do well and then stop the medication, they get arrested on the streets because there's no more state hospitals open.
Petty crimes, accidental trespassing, loitering.
Yes, we're acting weird on the street. They ship them to jail and they get sentenced to prison, and they put them right next to murderers and rapists. That's tragic. Our patients, through no fault of their own, get relapse because they stop the medication. This is where long-acting can really avoid that. And then number 5, this is serious, suicide. Patients with schizophrenia kill themselves in huge numbers. Let me tell you how huge. 10,000% higher suicide rate in the first 2 years of schizophrenia compared to young people same age in the general population who don't have schizophrenia. That's 100 times, 10,000%. And we know that it's due to lack of medication because when you draw blood from the bodies of those patients who kill themselves, there's 0 antipsychotic in their blood. So lack of medication, lack of antipsychotics leads to not only psychotic relapse, but also suicide in many of them. And then finally, they become homeless and they drift and they don't have living, and they live on the bridges and they take drugs and they get infections and they eat poorly. It's a horrible lifestyle. And then they die prematurely. the average, I mean, these many studies have shown that patients with schizophrenia lose about 25 to 30 years of life. They die prematurely from a variety of causes, not just suicide. Now, the good news about long-acting injectables is that you can protect them from all these 6 tragic consequences by preventing tissue loss again and again, preventing treatment resistance, preventing functional the disability. They can go back to college or work. They prevent them from being incarcerated. Actually, studies have shown that patients who take long-acting injectable rarely get arrested. Number 5, they don't kill themselves. Several studies now show that patients receiving LAIs have far lower suicide rate than those taking oral, for a good reason. And of course, it protects them from becoming homeless. So that is why I regard long-acting injectables as a must. And yet, only 14% of patients with schizophrenia in this country are receiving it.
And almost none at the first episode.
And rarely in the first episode, which is the greatest window of opportunity. If they do use it, they use it after 5, 6, 7 relapses, and then the doctor says, yeah, maybe I should give them a long-acting. I'm sorry,
It's too late.
too late. You have to give it at the beginning. It's too late in terms of recovery, but it still helps them avoid relapses, but they don't go back to function. So that is why long-acting injectables is a fantastic tool. We should use it very regularly and right after discharge from the hospital. We always use pills in the hospital because the nurses make sure patients are swallowing the pills. That's why they get better in the hospital. The minute they leave the hospital, the biggest mistake is to discharge them with a prescription of pills because they don't take them.
They don't take them.
And then the rest is history. That's why most of the patients get disabled. I have patients who went for 4, 5, 6 years and didn't get a single relapse and went back to college, went back to work because I use long. I want to save their life. I don't. Psychosis is like a, Bethany, you and I regard it as a brain attack, like a heart attack.
Yes.
Psychosis is a brain attack. We should treat it very seriously. It destroys the brain, which is the most important organ in the body.
So, Dr. Nasrallah, if LAIs are so good, then why are these so very underutilized?
Good question. It's a matter of attitude. Many psychiatrists were trained on pills, and they can continue using pills. But also, the discovery that psychotic episodes destroy the brain just happened 20 years ago. So many of the current existing psychiatrists did not catch up with the science, with the advances, and they continue the same habit of giving pills. And there is also this psychiatrists tend to be liberal people. They believe in exercising your civil liberties. Okay, some of them say, let this patient exercise their civil liberties and decide what to do. But they forget that the patient doesn't realize.
Is compromised.
Exactly. I mean, and people with a brain disorder cannot exercise their civil liberties wisely. But once they recover and they realize they're sick, the lack of insight does improve with time. LAIs can accelerate the recovery of insight. Oh. Then they can exercise their civil liberties. Yeah. So these are some of the reasons that they're not widely used in this country. They are much more widely used, by the way, in Europe. 40-50% of schizophrenia patients in Europe are getting an LAI compared to 14% here. Do you think that we could do something about LAI? We need to educate both the public so they ask for it. Families should ask for it when their son or daughter develops psychosis, because patients don't know they exist. They don't know that such a medication exists. And many psychiatrists are still they're stuck with the habit of writing pills, prescription for pills. That worked great for the general population who have a normal brain and they realize they need it. Patients with schizophrenia don't think they're sick, and they think they don't need the medicine. So they stop it the minute they leave the hospital.
Thank you, Dr. Nasrallah. Hoping very much to see more use of LAIs in the near future.
I hope so too. Thank you.